So we're going to talk about piriformis. Piriformis is a muscle that as massage therapists we're very focused on because piriformis causes what we all call pseudosciatica or piriformis syndrome. So let's just go over the anatomy for piriformis. Piriformis originates from the anterior aspect or the front of the second through the fourth sacral vertebrae. So it's coming from your sacrum, but the anterior front side of it. It's then going to come out diagonal to insert into the greater trochanter of the femur. That greater trochanter again sits directly lateral. It's at the very top of the femur. Actions for piriformis. It is the most superior of what's called the deep six lateral hip rotators. So the first and main action is it's going to do lateral rotation of the thigh at the hip. So it's going to move that thigh away from anterior midline. That's lateral or external rotation of the thigh at the hip. So that's its main action. It's also going to do just a little bit of abduction. So lateral rotation of the thigh at the hip and abduction of the thigh at the hip. Those are the actions for the muscle. Sometimes piriformis is tight because you're overusing those actions in some way. Many times, however, it's more of an issue with where the bones are sitting. Is the sacrum compressed? Have those vertebrae come into each other. That's going to shorten the fibers of those muscles this way, bringing them toward one another, closing up the space for the fascia within the muscle. That can actually create quite a bit of tension. That muscle can also be tight because the femur is either pushed into a posterior plane or the femur is stuck in lateral rotation. And that can tighten that muscle as well. So then you have to ask yourself, well, what causes that? Well, that can be caused by anything going on in the knee or going on in the thigh muscles. It could be caused by things going on in the lower leg or in the ankle or in the foot. So we have to kind of check that entire leg line when we're working on piriformis to see what might be causing the dysfunction in the hips and in the sacrum. So lots of things could be looked at as we're working on piriformis. When you look at the video for the SMRT releases for piriformis, there are quite a few of them. So we come at this from many different angles. But I also want you to check out the videos for the sacrum, because the sacrum is a huge part of releasing piriformis. It is, in a lot of cases, the missing link. It's the thing that many of us as massage therapists don't really think about. Then I want you to check out the videos for exercise and how you can balance the pelvis to do exercise that's actually going to strengthen those muscles. Because if you're exercising in a way where your hips are off to one side or the other, you are not gaining the strength that you need in those piriformis muscles. Pseudosciatica can be caused by the side that's overly tight, that's shortened. As that muscle shortens, it pushes into the sciatic nerve, which travels directly deep or underneath the piriformis muscle. But it can just as easily be caused by the side that's lengthened, because as that side lengthens and it flattens out, it pushes down into that nerve. So we need balance in those two muscles. So you really want to look for what's happening in the sacrum, possibly what's happening in the coccyx. That could be pulling the sacrum off. You want to look at what's happening with the hip bones and then what's happening with the femurs. You may have to go down the entire leg line to get a really good balancing in the piriformis muscles.